One of the greatest obstacles to crafting health and wellness is identifying and controlling inflammation. It's at the core of all complex and chronic diseases, and it's the driving mechanism that underlies the most common symptoms that people like you struggle to overcome. Join us as we explore cutting-edge science and research to give you the information and tools you need to create the quality of life you want and deserve. And now, here is the host of Inflammation Nation, Dr. Stephen Noseworthy.
Hey guys, welcome back to the Inflammation Nation podcast. I want to tell you where I've been for the last week. You might have noticed that I didn't publish any podcast episodes in the last week, and that's because we had a new grandbaby born. In fact, just about a week ago yesterday. So baby was born on January 12th, and nice little baby Benjamin, weighing about 7 pounds, 11 ounces, healthy, just a sweet, quiet, gentle little baby. And so my wife and I were on grandparent duty. We were taking care of the other grandkids while my daughter and her husband were tending to childbirth. And so that just changed my schedule a little bit. But we're back and we're on track, and we're going to continue talking about autonomous health, particularly, like what it is and why you need it. And I want to talk about why it is important to be relatively independent of the conventional system. That's what the word autonomous means. It means independent. So autonomous health means that you get to basically create your own wellness. Now, why is it important for you to take charge of that? Well, first of all, it's to minimize the frustration that comes from asking your conventional doctor to do things that they're not trained, equipped, or perhaps even interested in doing. Right? Medical doctors have their shtick. They have the lens through which they see health and wellness, or I should say disease. And sometimes that's incompatible with the things that promote wellness. We talked about this in the frustration matrix, or different aspects of that. Now, and the second reason to start becoming autonomous and taking charge of your own health is to master the main variables that drive chronic inflammation and chronic disease. And so let's just start with the first aspect of that. And I want to start by saying that you need to understand that nobody cares about your health as much as you should. Right? Nobody should care about your health as much as you should. And you should care, because being healthy and well does a few good things for you. And I could probably add more to this list, but let's just start with this. Being healthy and well improves your functional capacity, just simply the ability to get stuff done. It also helps you to develop resilience so that you can take a hit and keep on running, as they say. It gives you control and leverage over the factors that cause inflammation and chronic disease. And it just simply improves your quality of life, and it lets you show up in life as the best version of you that you can be. Now, when I say that you need to be relatively independent of your medical doctor, that doesn't mean that you never see them. It also doesn't mean that conventional doctors are uncaring, unemotional, logical robots. But I want you to think about this, because context really matters. The system within we as doctors work affects how we work, right? And so just think about, now I know I've talked about this in a couple of episodes in the past, but just bear with me for a second. But according to national studies, the average medical office visit is 7 to 10 minutes. Depends on which study you read, but it's always in that range. And yes, I understand that there are exceptions that some doctors take a lot more time. I'm talking about national averages. Also, the average medical clinic routinely double books time slots to allow for cancellations and still stay busy. What they don't want is to have a full roster of only the clients that they can handle, and have 20% of those people cancel or reschedule, and all of a sudden staff and doctors are sitting around going, okay, we could be seeing a patient, but we're not. And that's just a business tactic. I understand that. But it's also why people quite often sit in their medical doctor's office waiting for longer than the time they're actually in the office talking to the medical doctor or the nurse practitioner. But once your 7 to 10 minutes is up and your medical doctor is done with his or her time with you, they simply have to just move on to the next patient, who also has been waiting for a long time in a crowded waiting room with another 7-minute time limit to make some clinical decisions before they see the next person, and so on and so on. And the next day is exactly the same, and it's day after day, week after week. So how much time does that actually give doctors to drop into the moment and really invest in their patients' wellness and well-being? right? To get to know them, to really care about them as individual people who they have lives, they have relationships, they have passions, they have goals, some of which they may have given up on because they're not well enough and don't have the resilience and the functional capacity to actually pursue them anymore. Now, you know what the daily goal of the average medical doctor is? And listen, I know this because I've worked with them in different clinical settings. The daily goal is just to get through the day without messing someone up, or in the extreme case, killing them by prescribing the wrong medication. I don't know that's rare, but certainly it does happen. Right? For most of us, our medical doctors see us as another chart on the wall, another impatient patient who waited too long and has too many questions. And yeah, I know that sounds harsh, but that's kind of the characteristic. And again, it's the average. Exceptions do exist. One of the things that's important to know, and one of the reasons why we should be pursuing independence or autonomy from conventional medicine, is that, and even the Cleveland Clinic has come out and stated this. So again, I'm not making this stuff up, but Cleveland Clinic has recognized that about 80% of all chronic diseases are related to diet and lifestyle factors. And that means that most of the chronic inflammatory diseases that all of us are going to get eventually are modifiable, they're preventable, and sometimes they're even reversible. Even conditions like type 2 diabetes, which many think is a lifelong sentence. Many doctors think it's a lifelong sentence, and that's just simply wrong. And despite all the money that's been pumped into things like heart disease research, for example, heart disease is still the number one killer around the world. And globally, heart disease kills almost twice as many people as cancer does. I want you to think about that. And barring genetic exceptions, because there are some genetic issues that can promote heart disease, but barring those exceptions, heart disease is the result of poor diet and lifestyle choices, as well as some environmental influences, some of which we control, that modify our genetic expression to promote the formation of plaque. And it's completely preventable for the most part. And for the most part, it's reversible once you have it. Now, there could be a threshold beyond which you go that maybe you can't change as much. But the bottom line is we have leverage over the things that ultimately are going to steal our quality of life and ultimately cost us our lives itself. But the amount of time that it takes to properly educate people on finding their ideal diet or optimizing their lifestyle choices or changing their environmental inputs, it just simply doesn't fit into a 7 to 10 minute consultation, right? And we can't really expect conventional doctors who are trained to think and see things in a certain way to take on responsibilities for things in which they're not trained or are either uneducated or undereducated. And on that note, just I want you to ask yourself a question. You might already know this, but how many hours do you think medical doctors get learning nutrition in, say, the 7 years of training with their basic MD degree and then their internships? And the answer is it's less than 20 hours over a period of 7 years. That's not a lot. That's not a lot at all. That's mathematically, 2.5 hours per year. And same thing with exercise. And this has been published in national studies. So again, I'm not making this up, but medical doctors learn about, actually it's less than 12 hours on average. They learn about less than 12 hours per average in terms of exercise and the impact on health and wellness over the first 4 years of their degree. And again, that's less than about 3.5 hours per year. And so if we put those things together, which are two main components of diet and lifestyle, there are more, they only get about maybe 5 hours per year in the first few years of their training. And that's not enough to sit with any confidence and authority and say, okay, you have risk for heart disease, maybe you have heart disease, you've got diabetes, you've got degenerative neurological disorders. Here's what you need to do with your diet and lifestyle to start affecting that or improving that. It's just it's an incompatibility, or as I like to say it, it's a mismatch. And I have to say this again, and I know I've said it before, but I'm not against conventional medicine. I just simply believe in the right tool for the right job at the right time. And so when conventional medicine is used in the context of things like emergencies or end stage disease, or, say in my case, orthopedic surgery, I've had multiple joint surgeries because of anatomical defects as well as sports injuries. I'm not going to try to heal those things with an herbal concoction, although I might use that to help dampen inflammation and help the healing process, which I certainly did. I'm not against drugs and surgery when prescribed appropriately, and I'm certainly not against individuals who happen to be medical doctors, osteopaths, nurse practitioners, and so on. And I have tremendous respect for any doctor of any type who can be honest with themselves and with their patients and say, hey, I think diet and lifestyle might be important here. It's just not my forte. So we got to figure out how to get you to someone who can help you. But here's my point, and this is kind of a larger point, is that if drugs and surgery was such a great option for chronic diseases that are rooted in diet, lifestyle, and environmental factors, then why do we still have so much heart disease? Why is it still the number one killer? Why do we have so much obesity and diabetes, particularly since the 1980s? And the reason is because the system doesn't work for that. It's just not working. It doesn't mean it's not working for other things, as I just noted. But the gatekeepers of our medical establishment, medical care, let's say it that way, are untrained and poorly equipped to deal with root causes, and therefore they're just relegated to controlling symptomatology. And so here's the cycle, at least as I see it. Over our lifespan, the sum total of our dietary choices, our lifestyle choices, and the environment that we live in interacts with our genes to create the larger mosaic of our health, which is either good health or bad. And then when something goes wrong, the medical system that we've developed is not focused on finding how those root causes have shifted your vitality. They're not focused on, as I've said in the last couple of episodes, finding how you lost your wellness and how to restore that. It's not designed to dig into the major driving factors of diet, lifestyle, and environment to make changes that can alter your genetic expression. No, they're not looking for wellness loss. They're looking for disease gained and how to manage that. And that goes, again, back to the paradigm mismatch. And here's the cost of that. And I don't mean financial cost. The cost of continuing to go to people who are untrained, undertrained, or not interested in what really needs to change is that things that could change, things that could make a difference, things that are under your control to change, remain unchanged. And so years, even decades go by while you slowly lose your resilience. Subtle changes creep in over time until you wake up one day and you feel like you're not yourself anymore. And maybe the future that you had envisioned for yourself doesn't even seem possible. And if you keep going to your doctor whose only options do not include the very things that got you to where you are and the very things that will undo it and restore your vitality, you end up confused and frustrated with more questions than answers and no clear viable path that you can see to get to the person and the quality of life that you know that you should have. Now, once you understand that, once you see it, you can't unsee it. It's a big problem. It's a very big problem. And so my challenge to you is this. As I close out this episode, are you ready? Are you ready to take control of the things that are the main drivers of the most common health complaints that ultimately at the end causes morbidity and mortality? Are you open and willing to change your diet? Are you open and willing to optimizing your lifestyle in areas like daily or weekly habits of activity as well as formal exercise? Are you willing to recheck your sleep habits, your daily circadian rhythms, the time you get up, the time you go to bed, the time that you spend binge watching Netflix, that you could be doing other things that are helpful for you? Are you willing to look at stress reduction, the influences of either relationship stress or work-related stress, if that's relevant to you? Are you ready to look at your environment and ask if there's a mismatch between the toxic burden that you carry and your body's ability to handle that? Because you got to be ready. Nobody's going to care about your health the way that you should, but if you don't care about your health, why should anybody else? All right, we're going to call it a wrap for that episode. Thanks for being patient with me when I took that week off to welcome my new grandson, little baby Benjamin. I truly appreciate the fact that you're still here and still listening. Now, of course, if you want more information about the work that I do, you can check me out at drnoseworthy.com. That's my main website. You can find me on major social media channels. They're doing a lot of work right now with Instagram Reels and short videos, little tips and insights. So you might want to check me out at Dr. Noseworthy on Instagram. And please remember to comment, rate, like, and follow. It helps other people find the information that they need to begin their own healing journey. All right, guys, I'll see you in the next episode.